Hello, everyone. My name is Becky Hosey, and welcome to Self Advocating on Your Healthcare Journey. Now more than ever, it's so important to be your own best healthcare advocate. Unfortunately, the way medicine is today, sadly, you can't depend on others to coordinate your care or have your best interests in mind. It all falls on you, the patient, to manage it. Really, you must look out for yourself and protect yourself. At the end of the day, you're the only one that must answer to yourself, and you are in charge. A little about me, what makes me qualified to give this presentation today. I am a chiropractor and physician assistant, and my life abruptly changed in 2015 when I developed severe non-specific symptoms, so something in medicine that we call subjective complaints, like fatigue, joint pain, muscle weakness, and I was ultimately diagnosed with an autoimmune disease called Sjogren's, and I had much difficulty navigating the healthcare system, which was just shocking to me. And I ended up writing a book. I'm the author of Girl on a Gurney, Trading My White Coat for a Hospital Gown, in which I meet readers from both sides of the gurney as medical professional and patient with chronic disease. Also, through my writing, social media platform, community, and medical lectures, I really want to change healthcare, how patients are viewed and treated. I want to empower others to demand better care and remind medical providers that being a patient is a vulnerable experience. Do you ever wonder what is happening in healthcare? I mean, for those of us that are middle aged or older, we can reflect back on a time when healthcare was very different, much more personalized. And there are many reasons why the focus of care has moved away from the patient, and we'll talk about a few of these. I mean, much of healthcare today is non-patient centered, which just doesn't seem like those words even go together in a sentence. There's been a lot of changes in medicine. There's something called the corporatization of medicine, which means you haven't seen very many probably solo practices lately. You know, what this is these big corporations that are sometimes non-medical buying up medical practices and taking the decision making away from the medical providers. The practice of medicine has changed so much with insurance constraints. I mean, providers can't even treat patients the way they want to, and that is very, very frustrating. Medical prejudices, I mean, what's happening in society is also happening in medicine. All the intolerances, the biases, that's all happening in medicine as well. So really, at the end of the day, you must be your own best healthcare advocate, and I will teach you how to. Patient burnout is real. You know, this was an issue before COVID, but things have drastically worsened with the pandemic. And extended wait times. It's so long to just even get an appointment. And what happened to sick appointments? I mean, you call your doctor and you're not feeling well, and they give you an appointment a month or two or three from now. You know, you have diminished minutes with your provider, increased costs. It costs you more with your copays, your premiums. There's been a lot with surprise bills. I mean, the US actually spends the most money on healthcare when compared to other developing countries, yet we have such a poor satisfaction and a lower life expectancy. Actually, 60% of all American adults have at least one chronic disease. So an Associated Press poll in 2022 revealed just how low the satisfaction with our healthcare system is. Less than half of Americans feel that the medical system is generally handled well, and nearly 8 in 10 Americans are at least moderately concerned about having adequate access to care when needed. That is pretty scary. You know, marginalized groups, gender, race, um, socioeconomics are particularly affected. Getting the most out of your health visits. Face-to-face time with your medical provider is limited in most cases, so you must make this time as productive as possible. So you arrive the customary 15 minutes before an appointment, wait anywhere from minutes to an hour or more just to briefly speak to your provider. They examine you and they're out the door. And you're thinking, what just happened? We will go through each one of these topics in separate slides. The first, preparation, then what to do during your visit, actions to avoid during your medical visit, things to do after your medical visit, and how to handle when your healthcare provider is not listening or dismissing you. So preparation really is the key to a successful medical visit. Research, research, research. Learn everything you can about your symptoms or your disease. I strongly believe that you should be educated about what is happening with your body. Make sure that you make goals. All right, make goals for the visit. Write these things down. Write down your questions or concerns. It's so easy to forget. You can even just use your phone if you don't want to use paper. There are many apps that you could use. Don't want to be the deer in the headlights. And don't feel bad about making a list. Medicine is consumer service, and you have hired your provider to help you. That is their job. You could also ask a trusted friend or family member to attend with you. So what to do during your visit? Be engaged, ask questions, take an active interest in your care. Have your list out and ready. That will let the provider know that you have questions and they just can't fly in and fly out. Stay focused on your task or goal. Be direct and ask for what you need, whether it's a lab order or referral, in answer to a question. If your provider doesn't answer your question, rephrase it and ask again. If you don't understand what they're saying, then ask them to use more understandable language. Take notes, or it's great if you can bring a guest. They can take notes for you so you can just focus on your interaction with the provider. Be open to suggestions. Because, for instance, I'll give you an example. So if you have had neck pain for a long time and maybe you've done physical therapy in the past and it hasn't worked, but you want to get an updated MRI, well, unfortunately, your provider may order physical therapy and you may not want to do it, but that's something they have to do in order to get the MRI approved. So just be open to their suggestions. Recap the plan at the end of the visit. Providers can forget things too, and recapping allows you to feel confident that your issues have been addressed. So things to avoid during your visit. Well, when we're not feeling well, we're not always at our best. And if you're frustrated, it can be a real slippery slope. Avoid doctor bashing. When you read my book, you'll understand I had many, many good reasons to doctor bash, but I just don't. It's not my philosophy to do that because it's just going to break down communication with your provider. Raising your voice. Obviously, being passionate is okay, but there really is an art to being assertive versus aggressive. Be mindful of your body language. Avoid getting off course. Avoid the rabbit hole. Keep it professional. Don't pry into your provider's personal life. It may make them uncomfortable and really break down communication, move the focus away from you. I mean, time is limited anyway, so you really do have to keep that focus on you. So what to do after your visit? Well, the way medicine is, you really have to plan on following up on the plan. It's so easy to slip through the cracks. Many tests need insurance approval, which will take time. And sometimes insurances have, 30 days or more to respond to get a test approved. And, remember that your health is on the line. So don't feel bad about calling the office back and asking questions. It's always great to set up your patient portal, so not just with the office, but with imaging or lab facilities. That way you'll get the results around the same time your provider does. And you might be thinking, well, I'm going to have no idea what all this means. However, when you review your own results on your portal, it's a check and balance system. It helps to avoid missed things. Your provider may be very confident and have the best intentions, but it's the system that causes things to be overlooked. Sometimes providers don't even get the results from tests that they order. So for instance, if you go on your patient portal and you see something that just doesn't look right, that will cue you to call the office and make an appointment or ask for the provider to contact you. It may be easier just to make an appointment for a follow-up just to discuss the results, because you don't want to be waiting, not knowing what a result means. And, providers don't always have the time to call patients anymore. So what to do when your healthcare provider is not listening or dismissing you? Well, as good patients, we're taught to be passive and that medicine is authoritarian. But really, good medicine is a team-oriented effort. And yes, you and your provider should be a team. And if you aren't, that's a big problem. And as your own best healthcare advocate, you must take an active role. It's okay to politely redirect your provider. Ask them to please stop staring at their computer screen or typing away. Many providers are much more concerned about getting their note done before the visit is even over. It's okay to say that they seem distracted. Obviously, reiterating the importance of your concern. And if a few attempts fail, then move on. I mean, it can be really hard if you have had a provider for a long time and they've only recently started being dismissive. But if it doesn't work, it doesn't work. And your life is on the line. Remember, there are so many amazing medical providers out there just waiting to help you. I can tell you that I interact often with future healthcare providers, and I'll tell you, they are very receptive to my story when I lecture to them, and they really want to turn medicine around. So I really am very positive about our future. So how to find the right medical provider? Well, I think the first thing to do is to talk to friends and family. But keep in mind that a provider that works for someone else may not work for you. There's personality differences, that really may make a big deal, that may be a big deal or a deal breaker, I should say. I mean, you can ask the person why they like the provider and try to get more details about their interactions. You may also ask to attend an appointment to see for yourself. Asking a trusted healthcare provider, I mean, almost everybody knows a nurse. Boy, nurses, they know the reputations of medical providers because they see the good and the bad. But if you have another, provider, say like your cardiologist that you really trust and you're looking for a primary care provider, I mean, certainly, I think it'd be very good to ask them who they would trust, who they would see themselves. Read reviews. These can be very insightful. I mean, some of them can be obviously garbage, but really, I mean, if all the reviews say this provider is dismissive, doesn't listen to me, then, don't choose them, obviously. Social media, I mean, many times providers will have videos online so you can at least hear them speak and listen to what they have to say prior to making an appointment. Joining a support group, like a patient advocacy group, or even a support group specifically for your condition. I mean, those patients, especially when they're local, would know who to go to and who to avoid. Self-care on your medical journey. Actually, whether you're on a medical journey or not, it's so important to properly care for yourself. You will not be able to help others or be fully present for the ones you love if you neglect yourself. Taking care of yourself is imperative to maintaining your overall well-being. And if you have health challenges, it can really overwhelm all aspects of your life. I say that when you have health challenges, there are no vacation days. So it's so important to listen to your body. Self-care is really meeting your physical, emotional, spiritual, and social needs. It's not selfish to be attentive to your own needs. So tips to take care of yourself. Be kind and generous with yourself. Treat yourself like you do your favorite person or your favorite pet. Listen to your body. Your body's always giving you messages. But how often do we really listen? So addressing your stress. Meditate. Do yoga. Tai Chi. Start a hobby. Regenerate. Take breaks. Rest. Get the adequate amount of sleep. Stay connected with others, especially those who are supportive. Remain positive and never give up. Final thoughts. Take an active role in your healthcare. Be your own best advocate. Stay attentive to your needs. Really listen to your body. If something isn't working, then make a change. Get multiple opinions. Keep pushing for the answers you deserve. Don't worry about hurting the provider's feelings. Your life is on the line. And remember, as a patient, you are a consumer, and there's no service more important than your health and well-being. You wouldn't accept the results if you hired a painter and they only painted half of your house. This would not be acceptable. So why should you accept subpar medical care? Remember, never settle for anything less than the best health care. In that you are the expert of your health, not your medical provider. It's you. You are the expert. Thank you so much for watching. Please like and subscribe for more content and visit my website. There you can sign up for my monthly newsletter, Demand More from Your Healthcare, as well as to receive publishing updates. And or if you have any questions, please email me, girlonagurney@gmail.com, and be well. Thanks again.